Dear friends,
This is Dr. Ganesh Mani. I'm the chairman of cardiac surgery at Max Smart Super Speciality Hospital, Saket, and also the president of Indian Medical Association New Delhi branch. I hope you're doing well and staying at home, observing all the precautions that we have recommended, including frequent hand washes, social distancing, and avoiding heavy exercise. While we do not claim that we can save every single patient that we treat, it is just possible that despite our best efforts, many patients do succumb to either their disease or their destiny. In this situation, the attendants or the family do get aggravated and start attacking the doctor as if every death is due to professional negligence, which we know is not. As a result, this causes mental and physical injury to the doctors and some of his associates as well. There is no justification for this violence. We should all remember that death is a possibility and a possible outcome in every single disease that is encountered. I am not here to sermonize, but I do feel that it does cause a disincentive for the medical professionals to continue giving care to patients who come to them with so much of hope. As a cardiac surgeon who has performed over 20,000 cardiac surgeries in this country, I do acknowledge that many of my patients have always treated me well, and they have given me the exalted position of savior, caregiver, etc. But I do feel disturbed when I see news items and television clips showing violence against doctors, and I feel it's totally unjustified. There is no reason for any doctor to willfully be negligent and not give the utmost optimal care to the patient. But despite his best intentions, mortality does occur, and we all know that in such situation, generally it is much out of the control of the doctor, who is only involved in the caregiving and not directly controlling the course of the disease, which is covered by God and destiny, if you believe in that. Recently, there have been so many episodes of violence against doctors, recently in Moradabad, in Chennai, and so on and so forth. I was most disturbed that when my very close friend, Dr. Simon Hercules, an orthopedic surgeon in Chennai, he died while he was treating COVID patients. And upon his death, when his family took him to the cemetery for burial, they were stopped, they were manhandled, their ambulance was vandalized, and they were sent back to the hospital. Subsequently, with a lot of police protection, the burial did occur, but the family people could not attend the burial. So this is a very disturbing thing, and similar situations of doctors getting injured while at work. This acts as a disincentive for us to continue giving the care that we have been giving. Also, it is a big disincentive for our children to take up medicine as a profession. The medical profession, which was called noble at one point of time, is now considered ignoble, and this is hardly because of the doings of the doctors. We have appealed to many leaders in the past to discourage this kind of violence and prosecute the miscreants, but it has not happened. Or if it has happened, it has not been a deterrent to more of these incidents from happening again and again. As part of the National IMA, as president of IMA New Delhi branch, I joined the National Executive of Indian Medical Association in requesting or in appealing to the government to form an ordinance or a law to prosecute against any kind of wrongdoings against the medical profession. be it violence, physical violence, be it mental abuse, or breakages of infrastructure, or any such things. All this should be taken up as a law. As there is a law against policemen, you cannot hit a policeman on duty. Similarly, there should be a law against people who try to manhandle doctors. It does give me a sense of pride to be a doctor and having practiced for 40 years. But it is disturbing that doctors are slowly getting deterred from continuing the medical profession. Thank you very much. Jai Hind.